Well, it's almost a couple minutes past the hour, so let's go ahead and officially get started. Welcome to the Healthy for Life webinar. This is our third in our series this year. My name is Heather Gavris, and I serve as our National Program Lead for the Healthy for Life initiative with the American Heart Association. All of our participants today are in listen-only mode. As you may have heard, we are recording today's session. The recording, as well as just the PowerPoint presentation, will be made available on the Healthy for Life Facilitator Hub in the very near future. Very similar to perhaps other meetings that you've been attending, we are going to be going ahead and using the Q&A function within Zoom. So this is located at the bottom of Zoom, and certainly that's a place where you can log your questions. We will certainly have time just for some open Q&A towards the end of our presentation today. As I mentioned, this particular webinar is our third in our series, and it is focused around participant engagement. And I'm super excited today that you're going to be hearing from two organizations that have utilized Healthy for Life within the past year as part of their nutrition and well-being initiatives. And certainly this past year has presented a number of challenges, but nonetheless, they were very successful in being able to integrate the Healthy for Life resources within their respective organizations. So I really delighted. We have three very experienced, very talented women that have been able to join us. And so I do want to take a moment and introduce each of them. So first of us, we have Gina Smith, who's graduated from East Carolina University with both her bachelor's and master's in health education and health promotion with a focus around community health. She is a certified health education specialist. For about 5 years, she served as the Eastern Regional Coordinator for the folic acid campaign through the March of Dimes. And then since then, she's worked for Yale University at their Center for Perinatal Pediatric and Environmental Epidemiology and the Yale Griffin Prevention Research Center. She's currently the Community Health Improvement Manager for the Yale New Haven Health System, where she provides that day-to-day leadership to the Get Healthy Connecticut, which is an initiative that is focused around the reduction of obesity as well as other chronic diseases, and certainly is involved in a number of health improvement initiatives in both the greater Bridgeport as well as New Haven regions. Also joining us is Marilyn Faber. Marilyn is currently the coordinator of parish nursing at St. Vincent's Medical Center, which is also in the Bridgeport, Connecticut area. She's working as part of a collaborative that has 80 churches, well over 200 nurses that are part of this program. She is currently the co-chair of their Healthy Lifestyles Task Force, which is really addressing the social determinants of health within the greater Bridgeport region. As part of the Community Health Improvement program or plan, she is working with a number of local community nursing schools in terms of providing that mentorship in public health by providing health screenings, education, as well as referrals, particularly in local food pantries. Marilyn and her team have been honored twice. In fact, once was in 2017. She was honored and awarded by the Connecticut Hospital Association as a hometown hero. And then in 2019, the Community Service Award for the work in food pantries. She is also responsible for the on-site mobile food pantry at the hospital and is board certified in holistic nursing as well as a certified healing touch practitioner. Lastly, we have joining us is Reverend Davis. Reverend Davis has been in the U.S. Navy for over 28 years. She served in our United States Navy and then certainly retired from active service in 2016 as a lieutenant commander in the Navy Chaplain Corps. She's earned her bachelor's in business administration and human resource management in 2000 from Southern New Hampshire University. And then follow up in May of 2004, she graduated with honors from the Turner Theological Seminary based in Atlanta with a Master's of Divinity. She also has masters in both management and leadership, as well as an MBA from Webster University. And I recently learned she's now a PhD candidate at Regent University in organizational leadership. And lastly, Reverend Davis is a member of the 8th Episcopal District of the African Methodist Episcopal Church, the South Mississippi Annual Conference, and the Southeast District. So I mean, I am so honored to have joined these, very experienced, talented women and guests with us today, just to share their perspectives and ideas with us. To get us started, I do have a quick poll, and it's more about getting to know you and where you're located. I suspect there's people from all over the country, maybe in urban, suburban, maybe even rural areas. Maybe some of you are in sunny parts of the country. Some of you might be in parts like myself where there's snow on the ground. So again, if you wouldn't mind just sharing where you're based and get to know us a little bit. And I guess if we have anybody outside the US, that's certainly an option too. Just give people a couple more seconds. Great. Well, it looks like probably we have the largest contingency from the Midwest, but great representation across the country. So that's great to hear. So thank you so much for letting us know where you're joining us from today. So when we think about just Healthy for Life and what brings us today, I am going to provide just a really brief refresher in case there's some of you that have just joined and are hearing about Healthy for Life for the first time. Healthy for Life is our umbrella relationship between the American Heart Association and Airmark, and it's really sort of led by our leadership commitment, and that is to improve the health of all Americans by improving people through the healthy food, nutrition, and lifestyle choices that they're making each and every day. The relationship started in 2015 and really encompasses 4 focus areas. One is around sort of menu impact and innovation. The second is around consumer awareness. The third is around employee health and well-being. And then the fourth is around community engagement, which was really our sort of focal point for today's conversation. Through the evolution of working together, the American Heart Association and Airmark, we have co-developed a community nutrition program, again, really aimed at changing that relationship with food and nutrition, particularly by inspiring individuals and families to make those healthy food choices an everyday part of their lives. And so that's done by engaging and empowering communities, particularly those that have greatest need, equipping those community-based organizations such as yourself with science-based and evidence-based resources and programs, all with that goal of equipping individuals with the new skills that he or she needs to make in terms of improving their overall health. So we have, certainly co-developed and built out a great comprehensive suite of turnkey resources. And that, today is what we often refer to as our Healthy for Life educational experiences, which are, developed so that they are truly interactive. They are built on building people's food literacy at the same time as sort of building their confidence around healthy food preparation. They're based on the American Heart Association science, and so our evaluation has continued to inform our curriculum, as well as, we've received input and guidance from facilitators like yourselves in terms of what else is necessary in terms of content that we hadn't created. To date, I will tell you, we have a total of 37 individual educational experiences available in English and Spanish. And in the last year, we have also had Healthy for Life approved and is now part of the SNAP-Ed Policy System and Environmental Toolkit, which is a great resource for health educators and those involved in SNAP education. So lastly, I will share, I think all of us recognize that this past year, we've experienced some extraordinary times. Many families are certainly faced with some difficult choices. Obviously, one of the benefits that we have seen with COVID-19 is that, individuals are in fact cooking and at home more often. And perhaps that is a habit that we would hope will continue. So if there's a bright spot out of the pandemic, that might be one of those bright spots to look forward to. But nonetheless, we recognize at the American Heart Association that, certainly these are extraordinary times that, individuals, organizations are certainly facing. But hopefully our resources through Healthy for Life can, certainly support those organizations and individuals in terms of helping you accomplish your respective goals. So with that, I do want to have our team members, Gina and Marilyn, really kick us off and share their experience, in the last year working with Healthy for Life.
Thank you, Heather. I'm going to start. My name is Marilyn, and I'm going to have you go to the next slide where I'm going to talk a little bit about this Health Improvement Alliance that we're a part of. So Gina and I have been a part of this for some time now, although it was in existence before we even joined it. The Health Improvement Alliance is a coalition formed in 2003, and it was set up to help address all the health needs that were in the greater Bridgeport area. So this was even before the Affordable Care Act and our community health needs assessments and things that naturally kind of brought hospitals together. So the community is the towns of Bridgeport, Easton, Fairfield, Milford, who joined us this past year, Monroe, Stratford, and Trumbull. So they're basically all border towns. HIA is the co-lead of two neighboring hospitals. So it's St. Vincent's Hospital Medical Center and Bridgeport Hospital, which is a part of the Yale New Haven Health System. St. Vincent's is a part of Hartford Healthcare System, which are the two largest healthcare systems in our state. So they are somewhat competitive most of the time, but under this, we all work together and we work, as I say, we play well in the sandbox and have for a long time. There's also 40 other member organizations, including the FQHCs in our area, all the health departments, and several other organizations that are a big part of what we do. The Bishop Gene Williams Pantry is the pantry that we worked in, and we've had a relationship with them through this HIA for several years, probably 7 to 8 years now. We've been doing some work in that pantry. But that particular pantry is run by Pastor Mary Williams and her husband, Mary Green, I'm sorry. And she provides emergency meals to those in need. And they didn't stop during COVID. All the others kind of closed their doors, tried to regroup. They didn't stop. And it actually started serving more families and moved their church out of their building so that they could provide food for more people since there really wasn't anything readily available. So if you can go to the next slide. So facilitation in our project plan, the reason that we've been working in pantries for many years now is a program we call Know Your Numbers that we started in 2014 to try to address the health needs in the city of Bridgeport. So it was a campaign with the city council. I know my numbers. Do you know yours? So it was really a media campaign to begin with. And we started doing health screenings with student nurses, and it kind of grew from there. So we've done some research that has been published on it. So we use specifically two local nursing schools more often than others. So Fairfield University and Sacred Heart University that are both located in Fairfield. And they facilitated the workshops with the support of their professors. So we use their public health students. It's their final course before they graduate with a bachelor's degree in nursing. This provided them with a valuable hands-on community health experience. So what we decided to do, we've been when I go out, I help them and conduct a 3-hour simulation lab just for the Know Your Numbers screening, because as a part of the Know Your Numbers, we do blood pressure screening, A1C screening for diabetes, BMI, waist circumference. So we have been testing that for many years now. So that was a part of what we wanted to do, to continue to do these health screenings, but we wanted to get more hands-on with the people that we were working with in these communities and kind of connect with them at a different level. So the students went through a 3-hour sim lab for the Know Your Numbers pieces of it, using machines and things like that, and also for the Healthy for Life. So each student was given access to the curriculum, and they were also given access to the facilitator guide, so that they all were on board and able to actually pre-plan everything. So Gina and I were there to help them, but they were mostly doing the work. So the initial plan included conducting a 4-week workshop at 2 separate food pantries. Bishop Gene Williams, which I spoke about in the first slide, recruitment began in late January. They were in the midst of a 10-week program to improve their health using SMART goals. So we kind of caught them on week 3 and did all their numbers for the Know Your Numbers, and then started the lessons the week after with the students. So we did 4 Healthy for Life lessons that were previously established by Pastor Mary Green and her volunteer group. And every week we had about 20 participants, and they were very engaged with the students. We had also planned to go to Eat Smart Food Pantry, which is another local food pantry that we have done Know Your Numbers in. So familiar with the people that run it, familiar with the volunteers, familiar with some of the clientele. So we worked with the staff to distribute flyers and kind of get people registered. We recruited participants to start, and we did their Know Your Numbers and did all of that. But unfortunately, before we could even begin with the students doing the 4-week program in March, COVID came about and we needed to stop. So we were not able to actually provide Healthy for Life in that food pantry. If you could go to the next slide. So the Healthy for Life lessons that were chosen by Pastor Mary Green and her volunteers, along with input from Gina and I, and also from the students, because we kind of wanted to find out what they would feel good about doing and familiar with. So it was the role of food in your health, and that was mainly about blood pressure. And Gina will talk more about what we did with that. We did the nutrition facts, label smarts. We did exercise within reach, and we did all the flavors of the garden. And they were all very well received. They were very easy to, for the students to look over and be able to present on fairly short notice. Like they didn't have a lot of, pre-planning in all of it. Gina and I were there to help, and we were able to do some of the incentives and things like that. So Gina's going to talk more about that. So I'm going to turn it over to Gina.
You can go to the next slide. Thank you. So I'm Gina Smith, and like Carolyn said, we work at competing organizations, but we always come together for community health work. So as you saw the lessons that we chose, we wanted to make sure that when we picked incentives that matched up well with that particular lesson. So that first week, which was also part of our sort of Know Your Numbers campaign with getting people to know their numbers, we were able to buy them automated blood pressure cuffs to make sure everybody had one. And with that, the very important step to that is making sure people know how to use it. And so we were able to use the AHA really great infographic that they have about how to use an at-home blood pressure cuff. And so each student was able to pair up with 1 to 2 participants and really give them one-on-one attention and show them how to use their cuff, what the numbers meant, what to do if the numbers are too high, and how to track it. So that was week 1, and it went along really well with the lesson of that week. Starting that week, sort of behind the scenes, the students also had a healthy spice drive that they started to collect healthy spices, so that you'll see in week 4, we gave those out because we're telling people not to use salt or products with salt in it. What else can they use to help flavor their food? And if anybody works closely with food pantries, you know that there's not always a lot of spice options. It's like one of the things that they don't normally have, at least in our area. And so to be able to have access to spices is really important. So the students were able to do run their own spice drive, and then they were able to package them up and give them to the participants at the end. In week 2, we started doing a $10 grocery store gift card every week. And this is really key. I mean, we're working with food pantry clients. Obviously, food insecurity is an issue. And so being able to give a grocery store gift card was very important. And we made sure that it was a store that was easily accessible to the people that utilize this food pantry. We also gave out those Let's Be Well toolkits that we got from the AHA. They included hand weights and recipes and lots of great information, and they were in a nice box. People loved getting them. We also gave them cutting boards and these bookmarks that we have about how to read a food label, which matched up really well with that week's lesson. The third week, we did the grocery store gift card again, but we were also able to give out pedometers and resistance bands because that week we focused on physical activity. So we wanted to give them something that matched that lesson. And we had them bring back their hand weights from the week before so we could show them how to use them. And then finally, in week 4, we gave another grocery store gift card, reusable grocery bags, and the students actually took all of the spices that they were able to get during their drive and packaged them up really nicely and gave everybody a bag, and that was really well received. People enjoyed getting those. You can go to the next slide. One other thing we did actually end up purchasing was the food pantry manager was telling us that she really wanted to have scales so that the food pantry participants could weigh themselves and see how they were doing along their health journey. And so we did purchase 2 scales for the pantry to use so that the clients can weigh themselves. So lessons learned, as we all know, if you've ever done any type of community education, incentives are a must. And they really go a long way in trying to think about what would be the most beneficial to those participants. And I think the grocery store gift cards were definitely probably one of the most popular items, but also that automated blood pressure cuff. People really enjoyed getting one. They really enjoyed learning how to use it and being able to track their blood pressure at home. Participants really benefit from working one-on-one with the students. We were able to match up one student to 1 to 2 participants, so it was very small groups. And so after the lesson of the day, they met in their little small group and they talked about their setting their SMART goals. The students even called to check in on the participants throughout the next week. We had about a week in between each lesson. And they really liked, getting to know that one student, and they really felt, that they were being heard and they got to really connect with somebody. They loved the hands-on cooking portion. So every week after the lesson, there was a cooking demonstration with one of the recipes that matched with the week and being able to taste test it. And I believe every recipe was well received by everybody. And we made sure we had copies of the recipe afterwards. And so people really enjoyed that part. And then participants really liked the short and sweet lessons. You get right to the information with Healthy for Life. And, when you don't have a lot of time and, people were, they're busy. And so to come in, get a really quick lesson, have a cooking demonstration and be able to set a SMART goal, it goes by really quickly, and they really enjoyed getting right to the point and being able to learn something very valuable. Obviously, we had a lot of challenges. I think, we had our plan and then COVID came. I think that's sort of like the motto of the last year. We're trying to think now on what we can do moving forward. We are contemplating doing a virtual version of it. And we're actually reaching out to our pantry partners now to see if they're now in a better place to maybe have us do something virtually. Working in a food pantry on the day that they have food pantry posed a lot of challenges. There's a lot of people that come in and out. There's a lot of need to, feel like you need to get through the lesson to get in your place in line. So really working with the pantry managers to make sure that maybe those who come to the workshop maybe get to go first in line for food, or working out something so people don't feel like they're losing their place in line, because we never want to do that. And having a champion at the host site is really important. Pastor Mary is amazing, and she really promoted our program and really got people to sign up and come back every week. So having that champion is key. I think there's one more slide. So here's just some more pictures. These are both of cooking demos, one where the students were demonstrating in front of the group, and then one where the participants actually got up and helped make the recipe. And you could see 2 quotes that we have. I really think that connection with the students, this is the second time that we've run Healthy for Life in this particular pantry, and they've just really enjoyed working one-on-one with those students. And the SMART goals, it was amazing to hear each week people report on their SMART goals from the previous week. They really were invested in them. And I think having someone who called them during the week and checked in on them made them feel connected. And it's interesting, you know, to look back at pictures and remember a time when we were all in a room together without a mask. And so hopefully we can get back there, but we are planning on doing something virtual, hopefully in the next couple of months.
Great. Well, thank you, Marilyn and Gina. Great suggestions and tips, as well as sort of a summary of the work that you did. It's great to hear how engaged the participants were, as well as the nursing students, in terms of building that level of connectedness. Just a quick shout out before we also hear from our other presenter. But again, if you do have questions, feel free to log them just in the Q&A function within Zoom, and certainly we will get to those questions during our Q&A time. And so with that, I am going to turn it over to Pastor Amy Davis to talk about their experience. Oh, you're on mute. There you go.
Greetings, everyone. Good afternoon. What a joy it is. One, I would like to say thank you, Heather, for this invitation, but I also want to let you know that this was Zion Chapel first time partnering with the Healthy for Life. And we were very excited, and we really enjoyed, and we also learned a lot as a congregation based on the information that was given. And this is part of our Ruth ministry and our Ruth Fellowship Outreach Ministry, which the R stands for Restoring, U stands for Unity, and T stands for Through and Hope. So it was Restoring Youth Through Hope Fellowship and Outreach Ministry that we desire to do to serve our community. We in the community that Zion Chapel is located in. It's a community of low-income families. There is a community that the neighborhoods is kind of blighted. And so we are partnering not only with our city councilmen, but also with our neighbors to help bring life back into our community. So with the Ruth Fellowship and Outreach, we started a monthly feeding and food ministry where individuals can come to the church a month. And not only would they receive a hot meal, they also left with bags of food to take home with them. And so that was our initiative before we found out about the Healthy for Life. And so that's what we were doing. And I don't mind going to the next slide now. And so when we initially joined with the Healthy for Life, you see we had some very great goals, and we had placed our schedule out. We were ready to go forward, and our framework. We had put out incentives. We had purchased like journals and water bottles, and of course the what we received. They loved it, so they also loved their box. In fact, they pretty much almost fought over the box that we received, and we also received. We also gave them. We turned those into door prizes, and so this was our initial plan. To COVID, we were able to get the initial Heart of Wellness month for Heart of Wellness Month. We were able to kick this off as an in-person opportunity, and we had partnered with we partnered with Christian Service Centers who provide food to the community, and then who supplies our food bank. And then we also partner with the lady that you see in the picture that's in the brown jacket. She happened to work for the, and make sure I'm looking at my notes. She happened to work she's a nutritionist, and she worked for the Mississippi State Department of Health. And so she was able, so that was this initial class where we were able to talk about my plate, 10 nutritionist tips, and we were able to also engage in a challenge to say, how could I gain more fruit and vegetables during that time? And how can I drink more water? And all of the participants that had signed up, they received a bag with, like I said, with a journal. They received a water bottle. They received their measuring cups. So we were preparing them in their gift bag for all of the other classes that was to come. And then we had a door prize as well for each class. You can go to the next slide, please. And so one of our community partner, like I said, Christian Service Center, is a jewel. And Christian Service Center in the city of Hattiesburg provide to, I don't even know their numbers, but anyone that has a food bank or food ministry, this is the person. So Jim Proud made sure that during each class and during our monthly food distribution, they not only were they there, they picked up a box, and mostly you know about the boxes that was out. And so this was a blessing not only to our church, but this was also a blessing to our community. And because of that, we also collaborated with local churches. So with this project, once we went virtual, we had collaborated with 25 churches. And so we wanted to be able to move this effort virtually, and we needed other partners because we were no longer in our churches. And so we showed up outside the church and had the food boxes, and so people they were able to drive up, and so we conducted our classes in the parking lot. And so as they drive up, so we got our exercise because we had our notes, and so we shared with them, and we gave them their recipes, we gave them the things that they needed as they drove through. So that was a joy. You can go to the next class. Next. So now we, as you see, that the picture to the right is to my right, and maybe to is how we set up the first in-person class, and showing individuals how to increase their water intake by placing fruit in it, and we talked about that. But now we're like I said, we're at our virtual class, which is via Zoom on June 27th, and we put healthy coping for grief and loss during COVID-19. I'm sorry, that was the bottom. Healthy eating for the heart and diabetes. We had a nurse, Sheila Giddings. And then we had exercising for the reach, so that we had a training person for that. And then we had a healthy way to reduce stress, and then I did that as well. And so we were able to do this virtually. We had many participants via Zoom, and we also did it Facebook Live. So we streamed it. We did the class through Zoom, but we streamed it through Facebook Live, and we got also a broader audience of people who were able to connect with us. And so it was really good. It was educational, and we had a door prize. So we also did a door prize, and people were either got a knife set, cutting board set, various different gifts. We can go ahead. Next slide.
Yeah.
Oh, well, I'm sorry. Let me go back to my notes. You can go back to it. And so, I'm sorry, you can go back. And the other thing that I would like to say that I thought that I was favorite, we did the healthy salad. We did the healthy salad competition, and when we included in talking about portion size and eating the rainbow. So we did another class virtually. That was in July. So in July, it was a chopped salad competition, eat a rainbow, Eat a rainbow fruit and vegetable and feed your potential understanding portion side. And so we continue with the theme of be well, eat well, and shop well. And so we wanted to make sure that we explain to the participant, this was another class that was virtually. And so we sent out prior to that class in July for everyone to go purchase their everything they needed for a salad. And then locally, people were able to come get their food boxes of everything that they needed for their salad. And so I end up cooking as well as if I was Rachel Ray, and so our media team had the camera on me in the kitchen, and we talked about those various opportunities about, not drowning, your salad with dressing, and we talked about the portion size, and we even showed what the correct portion size, and that also was a giveaway, a kit to help with the portion size. That was probably one of the really good ones because that was one of the good ones in my opinion, because a lot of people realize that in our question and answer is that making the salad, they never thought about the things that they really put in it. They never thought about the portion size, and many did not think about how they were drowning their salad with dressing. And so that was a pretty good class as well. And finally, we closed out. We closed out with our family. We closed out just educating individuals with what it means to be healthy, what it means to eat the rainbow. And we also made sure that the Live Well boxes, it had opportunity to go to those 20, well, they got one because we had a first half of it that we gave to participants that was in the in-person. And then we took the second half of the boxes that we had that we were preparing for, we gave it to one for a church so that if they wanted to continue. And just to update you, just on New Year's Day, we adopted 30 families and provided the traditional New Year, the black eyed peas, the rice, those things. And so we made sure we provided that for 30 families. And so we're going to continue the Healthy for Life initiative here at Zion Chapel. And once again, Helder, I thank you for inviting us. And as I said in the beginning, this was our first experience in connecting with the community and other churches, and also connecting with the Christian Service Center. That this program was introduced to people who had not heard of it, especially our church. And so they're very interested in continuing this program, and we're going to continue with the materials that you had already given us. So we thank you so much.
Thank you, Reverend Davis. Really appreciate your perspective and the thoughts in terms of how this was implemented within the Hattiesburg community. And I think what I heard from both organizations is the need and desire to collaborate with local partners, whether that's, other community-based organizations, food banks, schools of nursing. So both of you, your organizations did a great job. I do know that we have some questions that have come in. So just let me see where we're at. So a lot of people are very interested in the spice bags that were given out. And so what were the most popular spices that maybe participants received? So maybe Gina or Marilyn, if you want to speak to that.
I'm going to give that one to Marilyn.
Okay. So that we asked them to make sure that they didn't have salt in them or fat in them or anything that was not good for the person. So most of it was like a garlic powder, onion powder, things that would you could use quickly to spice things up a little bit. Some of them were pepper. There was pepper grinders. It was they had different spices in different bags. They also used, I believe there was, one of them had like a paprika in it. One of them had an Italian seasoning that was just like parsley and things like that. It didn't have any salt added to it. So you have to watch with Italian seasoning. So those were mostly what they were. We told them no adobo, no, none of the stuff that would be bad for the person, but they were slightly different. They weren't all exactly the same.
Yeah, great. I love the idea of a spice drive. I wrote it down myself. So that was a great idea. One of the questions I think for Reverend Davis was, because you had to switch from sort of that's in-person to online, how did you manage the provision of incentives?
We mailed them. So there was someone online. Let me say there was someone with me, and as people joined the webinar, whether it was through Zoom or whether it was Facebook Live, we wrote their name down. Just that they wrote their first name down. It was placed into a jar. And then I was able to reach into the jar and I pulled out a name, and then whoever name was called, they was asked to inbox us with their address and we put it in the mail the next day.
Okay. This probably for all of you. How did you make sure that people came back week after week in terms of their participation?
I can start to answer that. The students were really engaging the people. So I think they were looking forward to the next week. They would talk about what we're going to do next week and, and keeping up with their SMART goals, and they knew they were going to get a phone call. So I think all of those things helped. And certainly knowing that they were going to get incentives, these $10 food cards was incentive for them to keep coming back as well.
I would say for me, because I partnered with once we went virtual, I partnered with 25 churches, so that was 25 pastors, and I partnered with with what we call presiding elder of all of our district. So I went to the district, and so what the presiding elder, my presiding elder, which is Michelle Goodlow, she incorporated with her district. So that ensured not only the pastors of those churches, but also laity. And so she incorporated with it. And so that's how I was able to have them to come back.
Great. Gina, anything else to add?
I was just going to say two other things. Having that champion at the organization was helpful, but also, what was I going to say? Oh, this is what I was going to say. So we actually planned them so that it was like the 45 minutes before food pantry started, so that they had to be there anyway. They just had to get there a little bit earlier. So we were trying to work around their schedules on a day where we knew that, so it's not an extra time of them coming to that specific location. So we really tried to work with what might work best with their schedules, which is another just tip.
Helga, I should have said this too. I also, I marketed too. So with the flyers, with the naming the door prizes, it went on Facebook, every social media. So that was another thing. So people were coming to try to win a gift as well.
Great. And then I think maybe this last question is for the Health Improvement Alliance team. So if you could just remind the audience, like the provision of blood pressure, the blood pressure machines, how were those distributed? Did each person get one? How many did you provide?
Yes, through St. Vincent's, we have a foundation, and a foundation that has a fund for cardiovascular disease and diabetes. So we were able to get the funding to be able to purchase these blood pressure cuffs. And so even with the Know Your Numbers campaign, we were giving them out to people whose blood pressure was over 135 or over 80. and we were teaching them how to use them, even with the Know Your Numbers campaign. So for this, we wanted to be able to have the people go home, take it, track it, and really get used to using it. Having the students there every week to kind of troubleshoot if somebody was having a problem on how to use the cuff or not tracking it, not taking it daily or however. So were able to get them to track it better. But it was a fund that we've had available for a while.
Right. Thank you. I think the last question, I'm not sure it'd be anybody, but I know this often comes up in terms of, gaining that internal support. So I think, Gina, you mentioned the importance of having like that champion. So any tips on sort of building up that relationship with that champion, or how to best identify who that sort of organizational champion could be? Any recommendations with that?
I can answer some of that. I think, having the champion that's familiar with us too, right? Somebody that, knows what we've been doing, knows how we're, what our goals are for the city of Bridgeport, to try and connect with people, help people to, understand their health in a different way, understand what their numbers are, and how they can include exercise or how they can include eating to move towards those goals. So I think, not only having the champion, but really having a connection ahead of time with those people was important.
Great.
I don't know if Gina has anything else to add to that.
I guess it's just, even sharing some of the lessons with this particular, maybe it'd be that the leader of the organization and kind of showing them what the outline is and what it will look like. I think also just having the American Heart Association name on it is helpful. And so, when you're able to talk to whoever the leader of the organization is you want to partner with, I think showing them that and that it's proven, letting them see the lessons and that they are short and sweet and quick, and could help just benefit the health of their clients or their community. I think that that's another key way to maybe get in the door and get sort of that champion behind you and what you're doing.
Okay, great. Well, I think we are going to have to move on just in the interest of time. If you did log another question in the Q&A, I will certainly follow up with you as quickly as I can. Before we round out our webinar, I do have another quick poll, and it's really in regards to, what else do you want to hear about, learn about? So if you can give me just a moment to launch this next poll, because I would really love people's feedback in terms of, topic that would be of most interest to you, just, to hear about and learn about in the future. So we'll give people just a minute or two. Yeah, and this will help just really inform our kind of webinars going forward. So appreciate the input. We'll just give it another second in case people want to respond. Okay. Well, it looks like pretty even. Maybe participant retention still, still sort of the leading topic. So thank you for sharing. So with that, I just want to wrap up with a couple of resources as well as updates. We have released some new brief videos, and we've been releasing these through Facebook Live. They really do connect back with our existing topics within the Healthy for Life curriculum. So to date, we actually have 4 that have already launched. 2 more this calendar, or this month, I should say. And so feel free to utilize these. These are, readily made, pre-recorded videos that really do depict both sort of the nutrition education alongside the culinary skills. So feel free to access those. If you can't, access them through our Facebook page, please let me know. Speaking of Facebook, just a couple weeks ago, we actually launched a private Healthy for Life facilitator network group. And so this is an opportunity for all of our facilitators just to connect with each other. I do serve as the administrator for that group. So it is set up so that I have to approve people before they're able to sort of log in and post things. But know that that's a group and that you could certainly access going forward in terms of sharing ideas, getting questions asked, things of that nature. And then lastly, we do have an upcoming webinar. It is on March 23rd. We will be featuring our new resources that will incorporate universal design with the Healthy for Life materials. And so this is actually a follow-up to our webinar that we had in October, where we had a couple individuals from the University of Kentucky Human Development Institute joining us. So they're going to actually share the results after they did their pilot testing and made those adaptations, but also those refined resources will be made available prior to the March 23rd webinar on the Healthy for Life Hub. So it's a great way that we'll be able to introduce you to these new resources. And so with that, I just really want to, thank everybody for joining us today. And certainly I will send out both the presentation as well as the recording as soon as I can. And so again, thank you to all of our speakers for taking time out of their busy days and being able to share their sort of summary of work as well as their ideas. So I do want to thank Gina, Marilyn, and Reverend Davis for joining us today. And with that, enjoy the rest of your day and enjoy the afternoon.
Thank you, everyone.
Thank you.
Thank you.
Thank you.